Hello. Uh, are you able to hear me? Anybody?
Yes, sir.
Yes, sir.
Yes, sir.
Okay, okay. So thank you very much, everyone, for joining. As well as I take this opportunity to thank all the resource person who have joined today. Uh, so today we will have a four resource faculty. We will be starting with respected Nandini Madam. Madam is Dean MP Shah Medical College Jamnagar as well as OSD Medical Education. Madam is actively involved in all the different academic activity across the Gujarat and playing an important role in policy making. Madam, thank you very much from your busy schedule and will not take much time because all the sessions will be of 15 minutes and our today's session will be finished by 4:30. Daily we will have 6 sessions of 15 minutes. Over to you, madam.
Thank you, Chinmay Bhai, and welcome to everyone for the revision classes of BCBR. I am sure, being a medical student, though you people are faculty and PG students, you are definitely focused on your syllabus regarding the MCQs, what will be asked and how will we attend. And I have also appeared this exam at the age of 55 years, and I thought that I will not be able to clear this exam. But I ensure you, if I can clear this exam at the age of 55 years, you will definitely score more than the distinction. That is for sure. Here, I would like to thank Chinmay Bhai to invite me for the introduction. The first chapter of BCBR booklet will narrate this introduction different way, but my intention is here to motivate all of you, not only to be the exam clearer, but implement your knowledge and and what gain you have from this exam in your day-to-day life. Before 10 years, the scenario of the research, especially in the Gujarat and especially in the government medical colleges, was totally different. But few pandemics, few epidemics have opened our eyes, and now I feel that one research topic must be there with one of our UG student. One research, one UG student. So if with this goal we will proceed further, you can imagine where can we reach. Khali vaccine, if we invented the vaccine for COVID, that was a miraculous part from the India that we wanted to see. Friends, we know why research is needed in the medical field. It is needed to improve our knowledge and outcome. Just like when you are treating a patient, once you have been thoroughly investigated that particular area by any component, you will give an excellent output. You can enhance the care of the patient if you have been exposed to day-to-day upgradations of the medical field. You can develop the evidence. Since last few years in India also, the medicine is totally dependent on the evidence basis. So the research will definitely promote the evidences, and you can definitely advance your knowledge. All the type of age groups have been participated today. Postgraduates are focused on their nearby research, that is in the form of dissertations, and now NMC has done the this compulsory oral presentation or paper presentation and the publication. So one more steps you can move ahead after completion of the BCBR. It will be very easy for you. And those faculties who are getting promoted, those faculties who are in the tunnel of promotions, they are also having the same focus for publication to publication, two during assistant, two during associate. So with all these calculations, we are following this mandatory step of the NMC. But yesterday, I filled up a format one of our very prominent faculty of the Gujarat, and she was going to submit for her own purpose. But one question was there in that particular format, that for what you want to participate in the research. And I promise you that I wrote that is for my own growth. So, after completion of BCBR, after completion of your small primary goals, if you can extend your knowledge, if you can extend your competency, if you can extend your efficiency, not only for the benefit of the patients, for the students, for the teachers, or from the society, but if you will if you will extend your this capacity to develop further interest अपने आप के लिए, if you will reach to that goal, that will be a miraculous component, and I ensure you that when you will reach to that particular level, you will definitely enjoy the research. Innumerable of hypotheses will develop in your mind, innumerable of questions will develop in your mind, innumerable research you will be able to put on paper within few days. So the purpose of this BCBR training by Chinmay Bhai is as a revision of the BCBR classes, but I would like to use this platform to sensitize all of you that make research as a part of your life, and you will definitely enjoy the medical journey. Good luck. Thanks a lot.
Thank you very much, madam. Thank you very much for enlightening and giving your own view. That at this level also we need to involve in the research for a personal growth. Thank you very much, ma'am.
Thank you very much, ma'am, for highly informative session. I now invite Dr. Atul Trivedi, Associate Professor, Department of PSM, Bija Medical College.
Okay. Am I audible? Hello.
Yes, sir. Yes, sir.
Oh, thank you, madam. Thank you. Nice to meet you all. And thank you, madam, for establishing a good go for our today's discussion. Dear friends, we are after the introduction part. The first and foremost thing is came into our research journey is to develop a research question. A good research question is essential to focus on our research, as well as it gives the sense of identity to our research when the other people look at the research question. So to have a good research question is one of the essential requirement for to start our journey. And herewith I have a small presentation. Okay. So my in the discussion, actually, research question means what exactly? The research question means that it is a clear, concise, and open-ended statement that guides the research project by defining its focus and objectives. So you may come across with the MCQ, like what the research question is made for, and they give the few option. So you can choose the correct option with how it is written here. It serves as a central inquiry that study aims to answer and helps narrow down a broad topic to the specific manageable problem. So when you start your journey, you have a n number of the ideas in your mind, but for purpose of discussion, purpose of doing the research, it should be narrowed down and it should be clearly mentioned that what you are going to exactly do. Whether you are study the exposure with various kind of the exposures or various inputs in terms of their various variables and outcome. So in the ultimately what we are interested is that we look at what is the effect of the so and so. Suppose you are looking for the drugs, so which drugs is a beneficiary effect. So that things you have to you have to show how it will going to measure. So good question, research question is specific, researchable, and relevant to the field of the study. So why it is needed? Number one is a guide for the research process. Another is a set the boundaries that you are doing the research in the so and so particular study group in the duration so and so duration like that. So it will unnecessary when the researchers go out of the boundaries, it will prevent them. It provides a clarity about the issue on which you are doing your research and drives the investigation. So this is a idea about it. This is an example of the bad versus good research question. That what are the causes of stress? Suppose somebody has we want to study over this. That what are the causes of stress? Now causes may be the many, but your question should be right in a way that it should find the right answer. So it is necessary to find out that which is a right question rather than the right answer. Okay, so you are always in the search of good question. So which question should I ask so that I will get the correct answer? So this question is too broad and vague, making it difficult to focus on specific factor that causes the stress. Instead of this, just look at this. How does workplace environment affect the stress level in employees working in the technical companies, tech companies? So this is by looking at this question, you are now having a good impression that what the exactly research has done and what the things has been carried out in this particular research project. Okay. Now, if there are two type of the research questions, descriptive and analytical. So what, how many, or who, where, when. So if this kind of the question is asked, it's a describing. So it's a descriptive in nature. In when we are saying that why, how, if we are using this word in our research question, then it is a analytical in nature. Now, one very important component is a PICO. PICO is stand for the patient or population, I for intervention, O for the outcome. So good research questions should include this four thing. Few are available. That's PCOT, PCOS, PCOTS, double TS. That is stand for the time frame, type of study, and set. That is. So P stand for the P, population, problem, and patients. I stand for the intervention. C for the comparison. It involves the alternative to the intervention, such as placebo. You are comparing with the control group with the different treatment. So C for the that and O for the outcome. So what the exactly outcome which you are going to measure, such as symptoms, quality of life, disease status, cure, not cure, disability, whatever. So these four things should be included in the research question. One more thing that is very important, you may come across in the MCQ. What is the final criteria? Your research question should meet the final criteria, FINER. That F stands for the feasible. Whether the things, whatever the research question looks that it's a simple time scale and data are available. So it is feasible or not, whether this kind of patient is available or not, arriving in our hospital or not. Then second is I. I stand for the interesting. That motivates you and ideally others. It should be a novel component that it adds something new in context of method, sample, like that. So novel means it's not a you are copy paste or you are doing the something which is already had been done. So novel stands for the something new. Fourth one, E, for the ethical, very, very important thing, that your research question justify that part, that it is ethical. It can be done without harming the participant. And the last one is R. R stand for the relevant, useful to your field or society. So that is that makes the final. So final criteria should be applied to the research question. Now, when the research question has been created, one has to thought these 5 criteria and before the finalization of the research question. So that is all about the presentation. I will stop my presentation here. Okay. Now, a few questions. I think I have time for 5 or 10 minutes. Dr. Chinmay bhai? Dr. Chinmay?
Yes, sir, you have a time.
Okay, fine. These are the few questions that suppose this question means we are discussing few, I think it's visible or not? I'm visible? Okay. Suppose the question is like that. I will discuss few questions. Participant can raise their queries also. A clear research question facilitates to do the following. Suppose the question option is given. A, choose the most optimal design. B, identify the who should be the subject as study population. Specify the outcomes. C stand for specify the outcomes that should be measured, and all of the above. Now, in this question, it is mentioned that clear research question facilitates to do what exactly. So number one is the optimal design would be based on this. Number two, identify who should be included in the study population. That is also there. And also mention about the outcome also as the PICO, PICO. So means good research question should fulfill all criteria. So the correct option is all of the above is a answer. One thing that is also discussed is what is the first step in the life cycle of research. See, in the life cycle of research, you have to mention that the need of the data. Then again, you correct the format objective of the studies, and again, you look for the various research question, and then the things goes on. So what is the first step? That is identify the data needs. Okay. Few more question. The verb estimate is used in the objective of analytical research studies. Verb, that is estimate. Should I share this final article with you? Just a second. Okay, look at this part. Okay, it's visible to you, all of you. You must be gone through it. The verb estimate is used in the objective of analytical studies research. Yes or no? Is correct or not? The answer is no, because you are not going to estimate. Estimate means when you assess something. So in the descriptive form, it would be good in descriptive study, but in analytical research, why and how, that are the question we asked. Okay. Another question which is visible to you, that is the process of refining the ideas into research question begins with the general uncertainty about health issues and narrow down to a specific, concrete, and researchable issues. What would be the answer? Answer is already written here, but in our discussion just now, we have discussed that yes, that our research question should be clear, it should be specific, and it should be researchable. So that's why this answer would be yes or correct in this. Okay, let us take one or two more MCQ. Okay. Question is, If your objective is to estimate the prevalence of health problems in community in 2019, identify the type of research question this study is addressing. So there are different types of the research question: analytic, descriptive, hypothetical, and experimental. So here I am going to estimate the prevalence. That means I am going to describe, right? So that's why the ideal study design for this question is, or the research question is, descriptive research question. Okay, so B is a correct option. Okay, one more question. What are the sources of research question is are? What are the sources? Sources क्या हो सकते हैं? कहाँ से रिसर्च क्वेश्चन के सोर्सेज मिलेंगे हमें? तो एक तो हमारे पास जो लिटरेचर सर्च करते हैं, जो सबसे पहला काम करते हैं, तो रिसर्च पब्लिश रिसर्च लिटरेचर. So that could be one of the resource. Being alert to new ideas. You may come across with the many literatures or in the blog, in the news items. Many times you may come across and you may perceive the new ideas. So from there you also generate the research question. C is careful observation and teaching. So here your source of research question could be anything out of the A, B, and C. So that's why the correct option is a D, all of the above. One question is, which of the following verbs is perfectly used in the estimate of in the statement of the objectives of an analytical research study? So A, B, C, D, estimate, determine, study, describe. Here we are doing the analytical research. Okay, so our objective of this is an analytical study means why and how. That means we are not going to estimate. We are not going to study or describe, because these are the suitable for the descriptive study. But we are going to determine that which factors are responsible for the so and so issue. So that means that determine would be the correct verb for this study. Okay, so that's how we have. Okay. Okay, so that's how we kind of understood that what is the ideal research question, how to formulate it, what is the need of it, and utility of this research question, and which one is ideal. What are the criteria to understand the ideal research question? So that we have discussed in very shortly in the very short span of the time. Any query, any question from your side? I would like to answer it.
Dear Atul sir, thank you very much. And Nandini madam also, thank you very much for sparing your time and sharing your view with the participant. Am I audible, sir?
Yeah. Yes.
Yeah. So participant request to avoid multiple echo and everything, we have disabled the mic. So all of you are requested to ask your question in the chat box. Any question to anybody?
Chat box. Okay.
Right now we don't have any question. Okay. So also again, let me take this opportunity to thank Atul sir. And sir is always a pillar
Thank
for
you.
all these activities.
Thank you. Thank you. Thanks for giving me opportunity, and best of luck to for the participant for your exam. Thank you.
Thank you, sir. So let's start third and very interesting topic, that is literature search. Okay, so let me ask in the chat box, how many of you have done literature search? Put Y in the chat box. For the paucity of time, I may skip few of the things. Please use the chat box. How many of you have done the chat literature search? Yes. Yes, why we are getting from few of you. So it suggests that you all are active. Okay. So I have one more question. Before that, the acknowledgement is organizing committee, all of you, and Vasumati Sri Ganesh from Cumulative Knowledge Foundation, who has taken us to the journey of literature search. Okay, so let me ask the question: why you want to do the literature search? So as written here, it is to avoid the reinventing the wheel, to find out what other scholars are writing regarding your topic, and to learn methods and approaches that appropriate for your study, and to learn appropriate theory to support your work. Sometimes we are using this to demonstrate our audience that our contribution is something new and it is different from everyone else. Secondly, to demonstrate to our teacher that you can do effective literature search. And lastly, because literature review are an acceptable part of university project. When you are writing a thesis, you are writing a literature review. When you are preparing a project, you are writing a literature review. And for that, it is required. Okay. So usually for literature, so what we are doing, we are asking our faculty, then we read our book, and then we will go to the journals, publication, and comprehensive database. So there are three type of data available. Number one is the basic information like this: what is cerebral malaria, like what are the current advances in management of cerebral malaria, and the result of the research. Second is, so from where we will get this information? We get from type 1, that is which is providing background and factual information. Type 2, which provide current and past research, and type 3 provide a synthesis. So there are three type of resources: 1, 2, and 3. Example for number one is, these all are the example of number 1. That print books, electronic resources, example of free resources like free books for doctors, PubMed, Harrison's Online, all this. Type 2, all the different websites, PubMed, Embase, Vidyanithi, Biosys, all things. And in type 3, very few, that is concurrent database for abstract and review of evidence, and the handmade. So these are the type 3 literature search. Now, usually what we do, we go to the library to get a hard copy of the book. Otherwise, we'll search online. Okay. So online, our favorite is Google. Okay. Now, this is a scene of one movie. Can anybody guess and write in the chat box? What is the name of movie and what is the name of Arshad Varsi in this movie? Can anybody has any guess? 30 minutes. Yes, any wild guess regarding the movie or the name of Arshad Varsi? No, name of the movie is Faltu, Faltu. And the name of Arshad Varsi was Google. You can see here GLE behind. Okay, so Google is not favorite for all of us. But when we type like this to study the prevention and control of diabetes in India, we can get around 32 lakhs result. Same thing, we can search better by using a Google Scholar. Let me share my screen of Google so we can do it with practical. Okay, so in Google, I am giving an option. Hi. My most favorite topic right now, that is use of AI in medical education. Okay, so these all are the sponsored, and then we will have unsponsored. But if you look at all this article, we have to look lot many pages, and it may be possible that we have a few of the article which are written by Tom, Dick, and Harry. So rather than the next literature search, we have Google Scholar. I will just select this word. So now here we have a 47 lakhs article, but these are a scholar article written by an authenticated person or published in the journal. In most of the case, you will get the link here directly. Okay. And the other advantage is you can custom the range. For example, I want only 2025. Okay, so I have 46,000 articles. Then I can create an alert that if any article is published regarding AI, I can use of AI in medical education and create an alert. Okay, now see here, in inverted comma, it is only medical education. I want whole. So what I will do? Okay, and then I will put create alert. Now let me search again using the same inverted comma, and you will see the result will reduce. So we have only 153 articles because initially it was searching medical education separately, AI separately. Okay, so from 46,000 it has converted into 153 article. Okay, so similarly we have lot many database. These are the list of database available. Out of this, our favorite is PubMed. Okay, so let's go to the PubMed directly. And let me put it here same. So we have 19,752 article. Okay, so I request all of you to search in the mobile. All of you search in the mobile. So I think you all have also got the similar number of articles. Okay. Now, if you look at here, there are filter available. So these are filter based on publication date. For example, I will keep 1 year. So now we have a 5,000 article. Now type of text available means I want abstract, free full text or full text. Let me click on free full text. So now in last 1 year, free full text. Okay. I want clinical trial, meta-analysis, what? I want only clinical trial. Only 133 article. Okay. Then I can have an additional filter. I want only English. Yes. I want only human. Yes. Okay. So like this, you can give the filter. Clear? Similarly, there is something known as field search. So now if you look at here the medical education is there, but here there is no word of medical education. So what I will do, I will put here TI in a big bracket. TI. Okay, so this is another field search. So in a title, wherever this word will be there, it should come. And there is something known as a stop word. So we have to remove this stop word. Okay. So what I will use? AI medical education. And in all that are known as a stop word. So no, don't use this. Rather use Boolean operator. So now I want AI, AND. So this AND is known as a Boolean operators. So wherever AI and medical education is there, that number of article will come. Let me search AI and medical education. So you can see 133 article. Now I will put AI or medical education. So either AI or either medical education, there are 2,827. And now I will put not medical education. I want all AI, but not medical education. So 1,000 article. Okay, so and, or, and not are known as a Boolean operators. Okay, and let's see few things regarding a field search in the PPT. So this is an example of malaria. You can see malaria is here, then malaria is all these places. Then also at one place in the abstract, okay? Then see, there is nowhere malaria, but the name of institute is the malaria. So this is not relevant. So we don't require this also. So what we will do? Avoid stop word, combine Boolean operators and, or, and, not. This we have already discussed. So these all are the stop words. Don't use this. Okay. So we can search for all these fields: title, author, page number, date. We can use all these things. Okay. So if we want to search chest and I want to chest in title only, I can find around few article. Then if I will put TIAB means title or abstract or both area. Then if I will put JOUR, so I will be able to select the journal with the name of the chest. Okay, like see, TI means chest in the title. Now if I put TIAB, then title as well as abstract. Okay, then if I put journal, then the name of journal will come where the chest name is there. Okay, so these are the few of the field search. Title is an abstract, journal title, author, AU, author's address, mass term, all area, page number. What is the full form of mass term? Can anybody write in the chat box? What is the full form of mass term? Can anybody write in the chat box? Yes, medical subject heading. So we will see how to search medical subject heading also, but this see the number of article. Only TI 27,000, TIAB 1,30,000, journal 31,000, author's name with the chest is only one. If only chest, 2,40,000. Okay, so this is the way it differs. So we already seen the Boolean operators when we are applying and, when both article will there, it will come, or everything will come, not, it will not come. Okay, medical subject heading. Now let me show you online. And here we will go to the PubMed basic again. Okay, here you can see mass term. So now it will be searching in the mass. I am putting diabetes or tuberculosis. And let me search in the mass term. So now this is the tuberculosis. So I will click here and click on the tuberculosis. So here you can see that tuberculosis word is used for tuberculosis, mycobacterium tuberculosis infection, infection mycobacterium, Cox disease. So everything, and below tuberculosis, these all are the minor heading and above is the major heading. Now, so for any of these search, we can use the word tuberculosis. Now, what you want to search? I want to tuberculosis diagnosis. Okay, add to search builder, and history, add to search builder, and surgery, add to search builder, and then I will search the PubMed. So here it will add tuberculosis diagnosis and tuberculosis history and surgery, and I have a 9 article. Okay, so for each and every title there are mass term. These are the terms which are entered by the staff of National Library of Medicine after searching, and so it is gradually get updated. For example, when corona started, so before 18 corona may not be there in the mass term, but after that it is there. Let me put diabetes. Okay, so we have diabetes mellitus here. So this is the mass term for everything. Okay. So this we have already seen in practical. Now, secondly, there are certain options available like I'm just searching it to show you different options available. Like we can save here, we can email it to whatever email ID we want to send. So we have to log in and then we can send. Then we can send it to clipboard, my bibliography collection and citation manager. Now here, this is a sort by most recent. Similarly, we can have a best match. Okay. We can have a first author or journal. Similarly, display option, we have a summary. Here you can see, or we want abstract full. Then abstract will be visible here. Okay, abstract is visible here. Then I will put only PubMed. Then it will be appear like this. Okay. And then we have a 10 option. I want to see 50. Okay. So these are some options available in a PubMed. And so if we use all these things, it will be beneficial to us. Okay. You can also go to the advanced search. Okay. And can you see here? What is this? Whatever I have searched and whatever number of results are available. Now, this will be useful when you are doing a meta-analysis or systemic review, and you will be able to see, or you will be able to see that in journal methodology it is written that you need to mention your search strategy. So we have to download this, and then we can add it as a search strategy. Clear? So here I can write. And then I have option and or. Okay. Okay, and then I can search and I can see how much numbers are available. 12 lakh numbers are available. Okay. So I think this is in short regarding literature search. Anybody has any questions regarding literature search? Otherwise, it is a 2-hour workshop, but we have converted into 15-minute quick revision. So these are other library available like concurrent library. This is for systematic review. Okay. And these are few of the portals or applications available which may be used for day-to-day revision. Okay. Any questions? Anybody? Okay. If there is no question, so as the mic is muted for everyone, you can write in the chat box if any questions are there. Okay. If we look at this, our BCBR PPT also. So, okay. So the technical team has removed the hindrance of unmute. So now you can unmute yourself and you can speak also. So here in this PPT, if you see, there is something known as a critical appraisal. So this critical appraisal is to appraise the article, whatever is already published. So for that also we can do literature search. So this all we have covered. all the different approaches, PubMed and or not. Okay. So this we will deal more when we write ethical issue. So any questions in this? Okay, if no, then we can go to the next topic. That is in BCBR, fourth topic is measures of disease frequency. Okay. So let's start. Can anybody define what are the measures of, or anybody write in the chat box, what are the different measures of disease frequency? Yes, we have a few reply in the chat box. A rate, incidence, ratio, okay. Incidence and prevalence, very good. So looking at the response, I realized, and I was actually sure also, that these all are actually revision. Odds ratio, incidence, prevalence. Yes, perfect. So let's go through the PPT of BCBR just to revise the content and which may be helpful for our exam. Okay. So why we need a measures of disease frequency? This is to identify the population at risk or to know the details of population at risk. For example, portion of the population that is susceptible to the disease, and this can be defined on the basis of demographic or environmental factor. For example, I'm in Bhavnagar, and if we have a more of a sickle cell disease, and if we have details of the participants available or patients available, we will identify them with the demographic or environmental factor, and we will put all these measures of disease frequency in the terms of demographic or environmental factor. Okay. For example, female populations are more at risk of carcinoma of cervix. Age less than, more than 30 and less than 70 are at risk in case of carcinoma, or population at risk of hepatitis B will be those individuals with the anti-HBC negative. So these are the example of different populations at risk. Okay. Now, one of the important measures is a prevalence. So how to measure the prevalence? P. Okay. So number of existing cases, old or new, in a defined population at a specific point of time. So I'm again repeating. So the question can be asked by putting a definition, then options will be what is this prevalence, incidence, ratio, whatever. Okay. So what you can put, the prevalence is number of existing cases, old and new, in a defined population at a specific point of time. So P is equal to people with the disease at a specific time and population at risk at the specified time multiplied by 10 above n. So in some studies, the total population is used as an approximation if data on population at risk is not available. So here we will put population, whole population, if we don't know whom to consider. Okay. So here we can see second measure, that is a point prevalence. What is a point prevalence? It is a measures the frequency of disease at a given point of time at this moment. So here it was number of cases in a defined population at a specific point of time. Okay. Here it is a given point of time. So applies when the data has been collected at one point of time. Like right now SIR is going on. So P is equal to C by N, and so C is equal to number of observed cases at the time T, and N is equal to population size at the time T. Now let's see the example. Okay, 150 children in the school, screening of refractory error done at a specific time. 15 children require glasses. So what is the point prevalence for refractory errors? 15 divided by 150 is equal to 10. So such calculation also asked in exam sometime, that 15 divided by 150 or whatever number is given, and you have to calculate. Okay, simple. So let's do the a simple testing, that rather than 150 children in the school and 15 children, if it is a 250 children in the school and 10 children require glasses, what will be the point prevalence? Can you calculate? 250 children in the school and 10 children require glasses. What will be the reply? Can anybody calculate and put in the chat box? Okay. So we have a different reply. Oh. So simply 10 divided by 250. How much? 10 divided by 250. Yes, so we have a lot many different reply. So here let's use Google. So it is a reply 10 divided by 250. So it is a 0.04. Okay. So don't get confused. It was a simple calculation, but then also in speed or in anxiety, we can miss the bus. Okay. Now let's go to the third. That is a period prevalence. It is a period prevalence. Measures the frequency of disease over some time. 1 year, 2 year, 3 year, 4 year. Applies when the data has been collected over a period of time. Okay. So PP is equal to C plus I minus N. So C is the number of prevalent cases at the beginning of time period. I is equal to number of incidence cases. So here is the prevalent, here is the incident cases that develop during the period of time. And N is a size of population for this same time. Okay. So this we should know. Now let's do the exercise. Can anybody calculate? I'm not revealing the result. You have an equation on upper side and data below. So population is of 150. So N is equal to 150. 25 had a disease of interest at the beginning. So C is equal to 25 and 15 new cases. So I is equal to 15. So please calculate and put in the chat box. So such a question will be asked to you in BCBR exam also. So I'm waiting for the result. $40 divided by 150. Is it correct? So C is equal to 25. So 25 will come plus 15 divided by 150. Yes, please put your result. 2.6. Let's see. So P is equal to, so first is point prevalence, that is a 17%, and here, so what they have done, C plus I divided by N is equal to 0.27. So here Dr. Sivangi is correct. 0.26 is equal to 0.27. Okay, so please keep this in mind. Now, what are the factors which affect the prevalence? Number of new cases, duration of the illness. If the disease is short, the prevalence will reduce. And if disease is long, the prevalence will increase. Okay, let's see the example. So increased prevalence, long duration, it can be because of low cure rate or low case fatality, increase in new case, immigration of patient, improved detection, e-migration of healthy people. Okay, immigration of healthy people. And decreased prevalence may be shorter duration of case, high cure rate, high case fatality, decreased new case, immigration of patient, improved cure rate, and immigration of healthy people. Okay. So changes in the prevalence may be have a multiple causes and it is difficult to interpret. We have to go into the detail of it. Okay. So this prevalence data will be helpful for assessing a healthcare needs, planning the health services, measured occur for condition with gradual onset, and studying chronic diseases. Now incidence. So we have seen prevalence, point prevalence, and period prevalence. Now incidence is number of new cases in given period in a specific population. It can be time, it can be day, month, year. We have to specify. Okay. So it can be expressed in an absolute number in terms of cumulated incidence or in terms of incidence density. Okay. So cumulative incidence is equal to number of new cases divided by population at risk at the beginning divided by 10 raised to n. And this is also known as a attack rate. The other name of cumulative incidence is a attack rate. Okay. Assume that the entire population are at risk at the beginning and was followed up for the time period of observation. Next definition is of risk. It is a probability that individual will experience a health status changes over a specific period of time or specified follow-up period. Now, when we are saying this, we are assuming that individual does not have a disease at the beginning or does not die from other causes during the follow-up. So this we have to keep in mind. Okay. And so it also corresponds to the cumulated incidence. Okay. Then third is a incidence density, also known as incidence rate. So is equal to number of new cases multiplied by 10 raised to n total person minus time of observation. Okay. Clear? So where we can use the incidence data, it is to describe the trends in the disease and to evaluate the impact of primary prevention program. To evaluate the impact of primary prevention program. So keep in mind use of incidence data, these two, and similarly use of prevalence data is for this. So this can be one of the question during BCBR. Use of prevalence data and use of incidence data. Okay. Now this figure shows the dynamics of incidence and prevalence. Okay. So this is the incidence which is coming up and this is the prevalence. So if both are equal, prevalence will remain the same. If the new cases and death or cure is the similar, the prevalence will remain the same. If death reduces, prevalence increase, new cases increase, prevalence will increase. So this is in nutshell very nicely explain the dynamics of incidence and prevalence. Now what is the relation between prevalence and incidence? Prevalence depends on the incidence and duration of the disease. If incidence is increased, then also prevalence increase. If duration of disease increase, then also prevalence will increase. So change in a prevalence from one time period to another may be a result of either of these two. Okay. So example. Okay, example of high prevalence and low incidence, diabetes. And opposite to it, low prevalence and high incidence, common cold. Is it clear? So based on the duration of the disease and number of coming, we can give an example. Okay. The next is a case fatality. Okay. So it is a place in relation to the number of deaths from the disease to the number of cases. And it reflects the severity, how severe disease is in case of case fatality. And it can be expressed in the term of proportion, in the term of ratio, but not as a rate. Clear? So case fatality can be expressed in the term of proportion or ratio. So lastly, prevalence is a static measure taken at point of time. Incidence is a dynamic measure taken over a certain time. And mortality is calculated using a population denominator to reflect burden, while case fatality is calculated using case as a denominator to reflect the severity. So here is the population and here is the case. Here is the population as a denominator and here the case is as a denominator. Any questions? Any question to anybody? Yes, you can calculate percentage also. This question was in regarding to what? So it is depending on the your need of calculating the incidence. It can be in the point or it can be in the percentage. Okay. So what we have covered till now, basics or starting of research, then research question, literature review, and measures of disease frequency. Now the further topic will be taken by Dr. Jay Solanki, our senior assistant professor, and having, I can say, the highest publication index of Medical College Bhavnagar. Over to you, Dr. Jays.
Yes, sir. Thank you, sir, for your kind introduction. So, am I audible?
Yeah, you are audible. Put it in the slideshow mode.
So it is in slide share mode only.
No, but we are not able to see. So do again unshare and share screen, not share the PPT, share the screen. First unshare. Okay, now share whole screen, entire screen. Yeah. Yes, perfect. Now put in the slides. Yes, now we can see. Yes, perfect. Go.
Thank you, sir. So this will be a combo of 3 lectures as given by Dr. Chinmay sir. And study designs are very important part of research, not just for the sake of BCBR course, because that will add the scientific value to your paper. And for what purpose you want to do research, that will decide your study design. So basically, depending on your motive of research, it can be a descriptive study design where there is neither comparison nor intervention. You just describe a group. Second is the analytical study design where you compare something, but you are just observing, not giving any active intervention. But the highest level of evidence comes from experimental study design, also known as RCT, randomized control trial, where comparison is done, but you are giving active intervention. So descriptive, analytical, and experimental. These are the 3 study designs, and what sort of studies come under these 3 heading that I'm going to share in brief. So the same thing, design. If you are doing intervention, it is interventional, and if you are merely observing, it is observational. Interventional, they are always analytical, okay, because you are doing intervention, so you must want to do analysis, and they are clubbed as randomized control trial. But when you are just observing, the study can be of 3 types. First is descriptive study, where you just describe either a case or a case series or some group. Based on that, it is case study, case series, and cross-sectional study. If you describe the whole population or a big group, it becomes ecological study, and you can do the comparison. Then it becomes observational analytical study. That can be, if you are doing vertical follow-up, cohort study, case control, where you have case group, control group, or it can be analytical cross-sectional study. Okay, so all this will be there in next few slides. The same thing we can also classify like this, that any study done in epidemiology, first you ask about assigning of exposure. So if you are not giving the exposure, then our study becomes observational. Second question in that series comes is, do you have comparison group? If no, it is descriptive study. If you describe at individual level, case report, case series, cross-sectional survey. If it is a big population, that becomes ecological search study. Within this observational study, yes, if you are doing comparison, it becomes observation analytical study. And based on the direction, if you go from exposure to outcome vertically, it is a cohort study. If you go backward from outcome and to check for exposure, it becomes case control study. But if you measure both at a time, exposure outcome, that becomes cross sectional. So these are the most commonly used studies for PG thesis and all purpose. But yes, if you assign the exposure, it becomes experimental or interventional study. Now that exposure is allocated with some specific method known as random allocation. If it is allocated randomly between two groups, it is randomized control trial. And if the allocation is not random, then it is non-randomized control trial. This is how you classify the study design. And this study design will guide not only just study design, but also the aim and objective, methodology, sample size, which tests you will use, and how you will interpret the data. So everything is based on the type of study design you choose. So part A, descriptive study, where there is no comparison and there is no intervention. Okay. So four types, as we just said: case report, case series, ecological studies, and cross-sectional studies. Okay. So case report, detailed representation of a single case. It may be a new or unfamiliar disease, or a rare manifestation, or some interesting finding in imaging or laboratory finding. It is useful to generate hypotheses regarding some pathophysiological mechanism. So in many journal, we have a section of case report. And in few journal, case reports far exceed the original articles. Say for example, this adenocarcinoma arising from a gastric duplication cyst with invasion to stomach. Okay, so this was a rare case report. It is useful to share your experience with other colleagues. Okay, it may be published in separate section of journal, as I said, separate section of case reporting. We will also talk about what is existing evidence or literature about this, and whether this type of manifestation has also been observed by other clinicians or not. Second descriptive type of study design is case series. As the name says, series means multiple observation study of larger group of patients, more than 10, with a particular disease, and larger number may allow the investigator to assess the play of charts, a common way of delineating the clinical pictures of a disease. But it suffers from the absence of, we just have one case group and no comparison group. So in history, this goes to the most interesting case series reported, pneumocystis carini pneumonia in Los Angeles, yes, in 1981, and that was the case series which brought into picture the possibility of AIDS. So that was a case series. Sometimes, yes, ecological studies are done where group is the unit of analysis. No individual level information on the distribution of exposure and disease is given. It relates whether the populations with high rates of disease also have high frequency of exposure. So exposure outcome is there, but unit is not individual. It is a group or a big population. For example, what is an average intake of fat among people living in particular state? So this is a ecological study. It helps you to generate hypothesis, because what you can see here is you can try to correlate. For example, ecological study, the trend of infectious disease in death in USA. So that will help them to guide for future research. Here the trend over time of death due to infectious disease is related to the policy or event changes in the society, but not presented at the individual level. This is how they have given the ecological study. Here we have the rate of disease, and it is for infectious disease. So you can see the trend over period of time, and that may give policy making sorts of input. For example, next, hypertension prevalence by country. So here the whole country is a single unit, and prevalence across various countries. Yes, when you see diabetes and such disease, we also have such ecological studies where the unit is big state or big country like that, and you can compare them. Fourth type of descriptive study is cross-sectional survey. As the name suggests, a single cross-section is done. It's a commonest study design. By definition, we observe a cross-section of a population at a single point in time. And unit of observation and analysis is an individual. It is useful to know the magnitude of disease or a problem. Census, for example, census is example of a cross-sectional survey. It collects information about disease burden, so it is also known as prevalence study, because what you study is a prevalence of some particular thing. Now, for this, recruitment of study participant, either from the whole population, for example, census, or some population sample, like National Family Health Survey. Okay. And the benefit of this study is that you can have observation for the presence of one or more outcomes and one or more exposures. So in a single cross-section frame, you can ask for multiple exposure, multiple outcome to have even more wide picture. For example, one of my article, heart rate variability is reduced in normal pregnancy irrespective of third trimester. So here it was a cross-sectional study which we did in normal pregnant female. So the group was this, and we checked for the HRV as a cross-sectional variable. What are the uses of this cross-sectional survey? So as we said, it is also known as prevalence study. It helps you estimate the prevalence of disease or a particular risk factor, distribution of health problem with respect to time, place, and person. It can help to plan healthcare service delivery or to set priorities for disease control. And at the end of cross-sectional surveys, sometimes you get some question which may help you to generate hypothesis, okay, which you can test in other studies. It can also let you know the evolving trends of disease, or it may be a before or after survey for an intervention or something. Uh, it is also sometimes it is done as iterative cross-sectional survey. Iterative means you do it repeatedly. You could do a preliminary analysis and then understand whether which of these risk factor might be playing an important role. It is known as analytical cross-sectional survey. A useful design in trying to measure the burden, understand the magnitude, to understand the distribution, and sometimes even to understand the effectiveness of a particular intervention. Example of research question to be addressed through the surveys, like, for example, what is the prevalence of hypertension in a particular city? How satisfied are patients attending government hospitals in Chennai? Exit survey. What is the prevalence of physical inactivity among school children? So this is sorts of research question. Advantages of cross-sectional survey is that it is fairly quick, easy to perform, and it is less expensive than studies like cohort or RCT. But there are limitations also of cross-sectional study. Not useful to study disease etiology. You cannot find out the cause. You cannot test hypothesis because you cannot establish cause-effect relationship. Not suitable for the study of rare disease. You measure the prevalent cases, that is some of old and new. You cannot get the incidence. Exposure and outcome examined at the same time. So you cannot tell who is the cause and who is the effect. For example, obesity, diabetes. Who causes what? That you cannot ascertain. Difficult to predict what happened first. I just gave example, just like egg or hen story. Exposure and outcome cannot be linked very well in this kind of study design because we don't have baseline data and we are not having multiple follow-ups. So if you want to summarize about the descriptive study design, case reports and case series are useful for uncommon clinical manifestation, which are useful for clinician. Ecological studies can be used to relate group level data and to generate hypotheses, while the cross-sectional surveys help to measure the burden or magnitude of health condition. Second type of studies is analytical studies. So as the name suggests, you are doing comparison. Investigator does not assign the exposure, no randomization, but it makes careful measurement of patterns of exposure and disease. And we have a comparison group. So it makes inference about exposure and the outcome or disease. So the first one of that is cohort study. So cohort was a word used for someone having military origin. Okay. So 300, 600 men who started in Roman army, they were the group or troop given name as a cohort. So similarly, if we have similar exposure, that group becomes cohort. So cohort in epidemiology, group of people sharing some common characteristic. For example, birth cohort, all child born on specific date. Okay. Design of cohort study, it will progress from exposure to outcome vertically. Begin with selection of exposed and unexposed cohort. Some of these exposed and non-exposed cohort individual will develop the disease, and the remaining people would remain non-disease. We will then calculate the incidence. So here we calculate not prevalence but incidence of disease in exposed and non-exposed population. And using this, we will compare the incidence using a measure of association known as RR, that is relative risk or relative risk ratio. So this is once again in short. Population we have chosen as a cohort, exposed group and non-exposed group, vertically follow up over the period of time, and who develop disease, who do not, incidence in this group, same who develop disease, who do not, incidence in this group, and based on this we calculate the, and as this is highlighted, we assume that exposed group have more incidence than non-exposed. Okay, for example, exposure may be smoking habit and the outcome will be some cardiovascular disease or event. So here we get relative risk based on incidence using this exposure outcome scenario. Now types of cohort studies. Okay, so I have given here nicely in this figure. So prospective means study starts over here, then there is some exposure and disease is then considered. For example, before birth, then at the birth they become exposed and then you look for the prevalence of disease, incidence of disease. Ambispective. MB means both direction. Exposure has taken place, you start somewhere between exposure and disease and then you follow up in this direction. So exposure and disease at the midway you have, so it is both retrospective as well as prospective, ambispective. And third is retrospective, means study starts over here, disease have occurred, so as exposure, and you go back in the retrospective manner. Framinghardt's heart study, Annelinda and urinary bladder cancer, it was the best example of prospective study in the literature. Okay, Framingham town, this much population, risk factor, don't risk factor, for example, hypertensive, normotensive, and they were compared for the incidence of CVD, that is known as Framinghardt's heart risk score. Okay, this is how you have the cohort study. Element of cohort study, 4 element: selection of study population, then gathering the baseline data, vertical follow-up, and the analysis for incidence and relative risk. This is how we calculate the relative risk or risk ratio or rate ratio. Now there are two words, odds ratio and relative risk. Odds ratio, this is what we use in cross-sectional study. But in cohort study, we use the relative risk ratio. Okay. So the 2x2 contingency table will be like this. Exposed group, non-exposed group. A will be the number of participant in exposed group with positive event. B means exposed group participant without event. C, number of participant in non-exposed group with event. And D is number of participant in non-exposed without event. Okay, A, B, C, D. And then this is the incidence in exposed group divided by incidence in unexposed group, and that will give you the relative risk. How to interpret if RR is 1? Incidence in exposed and unexposed is same, both have same incidence. Okay, exposure is not associated with disease. If RR is more than 1, It means incidence in exposed group is higher than that of unexposed. So exposure is positively associated with disease. But sometimes we may find other way around. Relative risk is less than 1 means incidence in exposed is lower than unexposed. Okay. So exposure is negatively associated. For example, if you are giving some preventive measure, then the exposed group will surely have less relative risk. Strength of cohort study. So it allows calculation of not prevalence but the more important measure, that is incidence. We can examine multiple outcome because we are using serial follow-ups for a single exposure. For example, just from smoking, we can have multiple cancer and multiple disease to be examined. We have clarity of temporal sequence. We can tell that what is a 5-year risk, 10-year risk, or what is a probable time taken. It will provide the cause effect association, that is exposure predicts the outcome. So for example, in the last case, if you want to see obesity or diabetes, what comes first, you can do the cohort study. It is good if you want to investigate the rare exposure, because the rare exposure should be followed like cohort study. So rare exposure, cohort study. Weakness of cohort study. So we may have to follow large number of subjects for a long time, which is sometimes not feasible, expensive, time consuming, not good for rare disease because rare disease will not occur easily, not good for disease with a long latency because you may miss the follow up. Differential loss to follow up, it can introduce a bias. So whenever we consider the cohort study, we always consider the loss of follow up. So 10, 20, 30%, that extra sample size we always add. Third type of analytical study is case control study. So case control, it will progress from outcome to exposure. So we select cases and control. Both cases and control are then interviewed to find out their prior exposure. And then we'll calculate
Hello,
the
hello,
exposure
hello, hello.
scores. Hello? Yes, among cases and exposure odd among controls. Okay, so here we calculate odds ratio. So same thing, just see here we start from the outcome and we go to check for the exposure. Okay, outcome, if outcome is positive, case, outcome is negative, control. Okay, case is for example carcinoma lung, and here it is non-cancerous patient, and then we ask for exposure. For example, smoking, smoker or non-smoker, smoker or non-smoker. So from outcome, we go back to exposure. That gives you relative risk. Elements of case control study. So same thing, you select the case, select the control, you ask about exposure, and then you do analysis. Okay, so for example, this was a case control study, hemodynamics and stiffness in hypertensive people. So case was hypertensive and control was non-hypertensive, and it was a cross section. So here once again the tables will be 2 by 2 contingency table, 2 by 2 contingency table. But here, rather than relative risk, we will take the odds ratio. So everything will remain same. Exposed, unexposed, event occurred or not. But here the ratio will be like this, diagonal. AD upon BC. That is A cross D upon B cross C. So whenever you get such calculation in your exam, always first make a table like this, exposed, non-exposed, event yes and no, and then AD cross BC. Okay, so this is the odds ratio, but you should not use the relative risk. It is only for the cohort study. Odds ratio interpretation same as that of risk, relative risk. Ratio 1 matlab equal exposure risk, more than 1 exposure is associated with risk, and ratio 1 it is not significantly associated with risk. Strength of case control study. It is good for examining rare outcomes. When outcome is rare, you cannot go vertically. You just start from outcome and go for exposure. Or when outcome with long latency, relatively quick to conduct, inexpensive. It requires few subjects and multiple exposure risk factor you can examine at a same time. But what are the weaknesses? You can have recall bias because many a time people may not give right answer about exposures. Selection of an appropriate comparison group may be difficult because you have to match the confounder. Case and control must be matched with respect to confounder, which is not always possible. Rates of disease in exposed and unexposed cannot be determined, okay, because both are different entities. So this was the second part, analytical part. And third part is pertaining to clinical trials, also known as RCT. Clinical trial, as the name suggests, it is trial means experimental study, and we are assigning some intervention. So interventional study. Clinical trials were on the main scientific advances in the last century. They are considered as the methodological standard of excellence and gold standard for scientific experiment, which provide the highest evidence for anything. Okay. Significance of clinical trials. Clinical trials translate results of basic scientific research into better ways to prevent, diagnose, or treat disease. Research studies involving people are designed to answer scientific questions and to find better ways to prevent, diagnose, or treat disease. Randomized control trial, or RCT, clinical trial is a planned experiment designed to assess efficacy of some prophylactic, diagnostic, or therapeutic agent, device, drug regimen, procedure applied to human subjects. So here we are trying something, so ethical issues come. It essentially involves comparing the outcome in a group of patients treated with a test treatment with those observed in a comparable group of patients receiving a control or standard. So we are comparing two things, one being novel, where the patient in both groups are enrolled in a prospective manner. RCTs are always prospective. Okay, they are treated or exposed to intervention, and they are followed up over the period of time. It is prospective in nature. The environment has been modified or it is manipulated by the investigators. As I said, it is a sort of ethical issue over there. But yes, randomization should be done to make two groups. Objective of clinical trial is to try new drugs or treatment, new medical or healthcare technology, or new organization delivery system of healthcare, new method of primary prevention, new programs of screening or early detection or screening tool. So when you have something new, if you want to try, you have to go for trials. So it is a therapeutic clinical trial, population suffering from a disease from which we take a sample, and then we have the randomization two group. First group is given treatment 1, new treatment. Second group is treatment 2, standard old treatment, and then we periodically follow up. Okay. And out of these, how many continue with disease, how many get cured? Here, same continue. So here you can see in treatment 1, cured fraction looks larger than this. So we can see that this new treatment is better than old with respect to this. Okay. So we start from here. In the future, we go for the cure of disease. Okay. In the therapeutical clinical trial. Randomization. Randomization is a process which ensures that participants have an equal chance of being assigned to one or two or more groups. One group gets most widely accepted treatment, that is gold standard or reference method. Other gets the new treatment being tested, which researchers hope and have reason to believe will be better than the standard treatment. Neither the participant nor the investigator decide that which participant will allot in a particular group. Now, this is known as blinding. It is done through neutral process. Randomization provides the best way to prove the effectiveness of a new agent or intervention. It ensures that all groups are as similar as possible, and confounding, co-intervention, and bias in outcome must be minimized. You cannot make it zero, but we can at least try to minimize it by proper matching. So, as I said, blinding. Blinding in clinical trial helps in balancing groups during the follow. Okay. Quality improvement in technique. Blinding can be at the level of participant. They don't know the intervention. Single blinding. Participant, investigator, both. Double blinding. And sometimes participant, investigator plus analyst. Triple blinding. But somebody should be knowing at least. So 3 levels of blinding. And whenever the clinical trials are there, it undergoes in these 4 phases. Phase 1, 2, 3, 4. Phase 1 is for safety and acceptability. Up to 50 healthy volunteers. If it is found okay, then it goes to phase 2 for the long-term safety, for dose, schedule, and early indication of efficacy. 100 to 500 low-risk disease people, not healthy but low risk disease people. If it is found safe, we go to phase 3. We check the effectiveness in real scenario because we apply it to high risk disease patient, 1,000 or more. And once this is clear, we put it into market. Once being in market, we go for phase 4, that is post marketing surveillance, 1,000 or more individuals, and it is a community based studies, and that phase 4 will ensure the surveillance forever. Advantage of RCT: it is the only effective method where we can control the selection bias because of randomization. It controls the confounding bias with cannot adjustment. It facilitates the effective blinding in some trials, okay, because that may affect the outcome. It maintains advantage of cohort study because you are doing the vertical follow-up from exposure to outcome. Disadvantage of RCT: it is more complex, expensive, it requires thorough training of all investigator. It lacks representativeness because we are choosing the sample. Volunteer may differ from population of interest. And ethical challenges, as I said, sometimes a new drug may have some health hazard also. So ethical challenges are immense. So key points at the end of the whole this session: the simplest sort of study design is case report. Reporting a single rare case is case report. Reporting of more than 10 cases, it becomes case series. Two groups, if they are compared, it becomes case control study. So descriptive studies are case report, case series, cross-sectional study, and ecological study. Most common type of study is cross-sectional study. Experimental study design, it is also known as clinical trial. And in RCT, the two important key parts are randomization and blinding. Clinical trial can be therapeutic or it can be preventive. Clinical trial is ethically most difficult to design, but clinical trial is also most complex, difficult design. In cohort study, we do the follow-up, vertical follow-up. In cohort study, we find relative risk. In case control, we find odds risk, that is AD upon BC. And basically, studies are of three category: descriptive, analytical, or experimental. So with this, I rest. Thank you all for your patient listening. Any query? Yes, can we have any question? If you have any question, you can put in chat box. Okay, so can we have Chinmay sir? Okay, so one is, can you share your slide? Yes, I will surely share this slides. We all are learning research. It is nothing like someone's patent. But yeah, when you teach someone, you become further. And as Nandini madam and Chinmay sir, Atul sir are saying that we all are from DMER or GMERS. Let us justify the R of research that we are supposed to. And let us do it beyond whatever is required, minimum possible to become AP or associate.
With this, we come to end today's online session. I sincerely thanks to all respected speakers and participants for their valuable time, insight, and active involvement. Your presence made this session truly enriching. Thank you once again, everyone. Have a good day.